Okay.
Now, KXAN brings you in-depth coverage, growth within our communities. This is Atxpansion.
New research, new technologies, and new types of treatment. We've come a long way in healthcare in recent years.
And the medical advances here in Central Texas will likely continue. Like a clot-removing procedure going on at Seton. They're using to treat stroke patients there. Doctors insert a medical device, or mechanical device rather, that works like a snake. It works its way up a blood vessel and removes blood clots.
I went from being paralyzed on one side of my body to being able to stand here and talk to you and explain what my experience was.
St. David's Institute for Robotic Surgery is leading training and research into robotic-assisted surgery. Robotic surgery is a high-tech tool that mimics a surgeon's movements. The surgeon looks at 3D images on a console to maneuver around, and because the pictures are in high definitions, doctors can see it much better.
We continue to get feedback from folks here in our audience and those of you watching on television and going through Twitter and Facebook and KXAN.com. And our Brian Sanders has a question from one of those sources. Brian?
Robert, this question is for Susan Griffin on our floor plant panel and has to do with nurses, and they're often the most trusted of the workers inside the hospital network. How is their role changing with the physician shortage?
Well, I think it just continues to become more and more of an issue. We have more burdens placed on us, and I think, you know, we at the hospital don't really have a physician shortage. I believe it's more of a shortage out in the community. So we don't experience that so much, but we do really have more issues around quality and safety as an ongoing factor to try to improve that and make things better all along.
Thank you, Susan, for that. You know, we talked a little bit about research and some of the new medical treatments that are going on in this community. Let's talk about research and some of the most promising things that are up and coming and are happening right here in Central Texas. Anyone want to share something that they see as something that is really cutting edge that's going to turn a lot of corners?
Well, I'll start. At St. David's Healthcare, we have some long-established clinical research programs. You heard a minute ago about the Texas Institute for Robotic Surgery. That's a newer one of those programs. But certainly through Austin Heart and the Heart Hospital of Austin, one of the largest private cardiac research programs in the country. They're involved in about 50 clinical trials there. The Texas Cardiac Arrhythmia Institute is actually recognized not only locally in the United States, but even internationally for the prolific research around cardiac electrophysiology issues there. And certainly in the neurosciences, the Neurotexas Institute at St. David's Healthcare is involved in some really progressive work as well. So we're very fortunate to be associated with a world-class university in this community, and this attracts physicians who want to collaborate with the university and do research.
What's going on at Seton?
Well, at Seton, we've begun the process through the Cancer Institute in terms of tissue samples that we're able to begin to develop biomarkers for individuals in terms of the kinds of treatments that would be needed and to ensure that the chemotherapies that are done to be the most effective treatments. And that research is evolving, and we hope it will bring us some good results.
What about stem cell treatments? Anybody want to speak to their role in the coming years here and the research on stem cell treatments?
We actually have an institute that's dedicated to stem cell research. It's adult stem cells, and they're doing work in both orthopedics, cardiology, and some interesting ocular ophthalmologic applications. I think probably most of us will be around to see stem cells being used. There's concern, I think, that stem cells may get into therapeutics before they've perhaps gone through some of the very rigorous kinds of research protocols that both Seton and St. David's have described. And so hopefully we will in fact ask patients to be sure that they're checking to see where they're getting some of these treatments. Just because it's new doesn't necessarily make it better, but clearly some of our work would suggest stem cells will be right there with robotics in the fairly near future.
We have an online question about chronic illnesses and diseases and prevention, and I'm looking at Paul Carrozza, who is very animated on this subject in preventing these types of things by well, getting up and moving, right?
Absolutely. We know that I say preventive medicine is great until you get sick, so it's great to be here today on the preventative side, because we know that we absolutely can get people in shape. Austin's doing that every day, and it's creating weight loss, and more importantly, it's creating mobility and a higher quality of life. And but people do get sick. So my wife 10 years ago had to have a Ross procedure at Seton, and she went from being a world-class athlete to open heart surgery, and now she's back to being a great athlete. So I've been through that. It is not just about preventative medicine. It's about having great medicine and getting people excited about living and controlling their own health through eating right, exercising, and we like to do it through an athletic strategy.
But I would also say that obesity is really a huge issue for us as a community and as a society. If you look at Texas, 20 years ago, 10% of the population, the adult population, was deemed obese. Now it's 25%. With that comes all the complications of obesity, the high blood pressure, diabetes, other things that drive extended cost into the system. So I think if we could get Paul to get everybody up moving, it'd be great.
But we did have a question from social media as well about how do we really market this prevention? Other than a doctor talking to, a primary care doctor talking to a patient, how do we market it other than Paul Carosa here?
Well, I think clearly, whether you're talking about prevention or whether you're talking about almost anything else that we want to encourage, incentives work. And so I think we may well see some changes in insurance that tell you that if you are doing the following things, you'll have a reduction in your insurance costs. I think clearly, and I'm sure some of you who are from Central Austin would be able to give me the names of companies, but there are companies who are putting in wellness programs, who are encouraging people to take a longer lunch break so you eat a small lunch and then spend some time being up and active. Clearly we need to get it back into the schools. All of us did the President's Physical Fitness Award and took our medallion home. Incentives work, whether they're saving money or giving something to kids who are doing the right kinds of things. We need to put them back into practice.
And the wellness opportunities there, we've offered wellness to our employees, and someone by participating in our wellness program can earn enough credit to where they actually pay for their health benefits. That's the kind of thing that I think the kind of creativity you've got to have out there.
What I would add to that is that I think for too long we've allowed the people we serve to basically take direction from their physicians and other clinicians. And I think and this kind of program is essential because I think this is where you begin to let folks know about accessibility, for people to understand their health care, to understand the things they need to do to stay well, whether it's eating habits, exercise, or to understand when they have a chronic illness, the things that they can do to manage that chronic illness, to ensure that they stay out of an acute care facility, can stay home, can stay at work. And those are things that the people have to engage in a very different way than they have in the past. And I think you can't solve the health care equation without that participation.
Dr. Alonso.